How do you know the difference between mental illness and demonic possession? It's a serious question. I have to say, in all my years of medical practice, I don't believe I ever had a patient with demonic possession or being haunted by an evil force or whatnot. I've treated a lot of patients with anxiety and depression, and I can confidently say I don't think any of them were possessed. I'm trying to think back right now. No, I'm pretty sure. However, there's a very well known psychiatrist that was able to differentiate and did just that. Believe it or not, mental illness versus demonic possession. Can you believe we're talking about this in 2025? Well, yeah, if it's on my channel, we're talking about it, right? And hi, by the way, if you're new here, I'm Dr. Andrea O'Connor. Welcome to my channel. And side note for those patients, I work today. I saw patients today and viewers. Yes, I am currently a full-time practicing physician, and I also have my RN license. So I hold 2 RN license. Sometimes I'll see comments in my feed of like, who are you? What are you doing? And all that. So yes, I continue to work full time, and I just love talking about interesting things. So what got me thinking about this was I kind of want to do a video about, the hospital. Well, I'll put that out next. The hospital that really was very off-putting to me. I dreaded walking into that hospital. So that'll be a separate video. Well, let's get into this one. Let's not put this off anymore. So have you ever heard of Dr. Richard Gallagher? He's a medical doctor. So believe it or not, he's a very successful New York psychiatrist. And he had a history of being very skeptical. However, one day a priest asked him, really like for a second opinion, can you please come evaluate this woman? We think we have a possible possession, and we may be doing an exorcism, but we have to rule out mental illness causes. Now, if you're like me, and I always like to go out there and look at all the really fringe things that happens with patients and really humanity at large, that is a thing. If someone is reaching out to their priest because they believe they're being plagued by demonic forces, evil spiritual beings or whatnot, they'll probably reach out to their pastor or their priest, and their priest usually has to make sure before they do an exorcism that they rule out medical causes first. So he reached out to Dr. Gallagher, this really well-known psychiatrist. And it's interesting because Gallagher was even surprised that he was dealing with a diabolical attack with this patient. This patient was actually possessed. So it kind of turned everything on his head for this doctor. He actually wrote a book. If you're interested, it's called Demonic Foes. Looks like here it's on Amazon. How much is it? It's like $21. Sounds like an interesting read. Well, let's get into that. Piqued my interest. Who is Dr. Gallagher, and what exactly did he do? And how do you determine between mental illness and demonic possession? Well, I mean, he's got a great background with his education. Looks like he went to Princeton and then to Yale University School of Medicine. He trained in psychiatry as a resident. Okay, so we've got some good background there. And then he was also an associate professor of clinical psychiatry at New York Medical College, where he teaches and conducts research, apparently. I don't know if he still teaches there. He was a faculty member at Columbia University, an instructor at the Roman Catholic Seminary. So it looks like he came from an Irish Catholic family. And then he's also a member of the International Association of Exorcists. Okay, I admit I didn't know that was a thing. And he was a longstanding American member since the early 1990s. See how much we don't know? Or how much I don't know. He served as scientific advisor on its governing board. Okay, so he's got a lot of background here, sounds like. So he grew up on Long Island, very strong faith background. And his brother Mark described him as an academic prodigy. Well, makes sense. His time at Princeton and Yale, of course. So his true work focused on distinguishing true demonic possession from psychiatric or medical conditions. And so he did act as a consultant to the clergy. He would work across denominations such as Catholic religions, Protestant, Muslim, Hindu. And his approach combined psychiatric rigor with an openness to paranormal phenomena, making him a unique figure in medicine. And that's why on my channel, like back in the day, because my first video was what was it, 11 years, 13 years ago? I don't know. I started on YouTube, and it was really just to promote my medical practice. But then as years have gone by, and I've always been interested in the paranormal, and then hospice blew my mind because in between building my practice, I was working for hospice, and my mind was definitely opened to there absolutely is a God and another side. And so now my channel's taken this huge turn. And really, I'm saying this in response to a viewer that put, okay, your credibility is just shot, what you talk about. Well, that's fine. That's your opinion. I'm just merely seeking the truth. And if I talk about entertaining things along the way, like scary movies and whatnot, um, yeah, I mean, you don't have to watch my channel, right? I just love exploring what we weren't taught in school, knowing that there really are things out there, especially in medical school. We were not taught all this spiritual paranormal stuff. And now, when it's like in your face, you can't help but recognize it. So I love what Dr. Gallagher did here. Someone asked him for his psychiatric opinion, and now he's open to this entire evil world of demonic possession. So apparently, over 25 years, Dr. Gallagher evaluated hundreds of alleged possession cases, concluding that only about 100 of them, out of hundreds, several hundreds, only 100 involved genuine demonic activity. So it says 100 out of thousands. I mean, that seems about right because, oh gosh, I remember I had to do an internship at the Arizona State Mental Hospital, and a lot of people, so many different behaviors and mental illnesses. Sometimes you would think, maybe there's something more going on here. Maybe there's some type of spiritual attack. Yeah, maybe 1 out of 100. I think that's reasonable. So get this, the clergy, including famed exorcist Reverend Gary Thomas, which was inspiration for the film The Rite, which I never saw, but now I'm thinking about seeing. Did you guys see that one? Relied on him to rule out mental illnesses like schizophrenia, dissociative identity disorder, or we call DID, or psychosis. He provided pro bono psychiatric opinions, ensuring cases met strict criteria for possession, such as, here's how he would rule it out. Was the patient in a trance state with demonic voices? Was there hostility toward religion when that was brought up? Did the patient have paranormal abilities? For example, speaking unknown languages that they were never taught, or having hidden knowledge. So, for example, I think he said in his book, Demonic Foes, that one gal that he was evaluating started talking about his own mother who had passed away with a lengthy battle of ovarian cancer. Like, how can this random patient he had never known or met know this about his own mother? So that was one of his criteria. This is real life. This is a real psychiatrist practicing in America. This is real. Can you imagine? Now, I want to say that I'm lucky that I haven't had a patient with any of these conditions that I've been afraid to be with them in the room in my personal medical practice. Now, in hospice, when I have to go out to facilities and hospitals, that was a little different. There was a couple rooms that I went in, and I've talked about before, that it was like, what is going on in here? This is dark. Like, what the heck? So let's talk about his notable case, the case of Julia. So this is Dr. Gallagher's most documented case. It involves Julia. Now, this is a different name than the real person, of course. Now, she said she was a self-proclaimed Satanist. She was a high priestess, and this was back in the 1990s when he evaluated her. He said that she was having symptoms like speaking Latin and other languages unknown to her, revealing secrets like his own mother's death, remote viewing. I'm thinking about that because there's so many videos about remote viewing out there, like the government being involved in remote viewing. That was one of the symptoms of demonic attack. Oh gosh, this one, I don't even want to say it. Levitating for 30 minutes during an exorcism, witnessed by 8 people, including 2 exorcists, as well as the doctor himself. So he details this story of Julia in his book. And he does describe this case as a once in a century possession due to the extreme paranormal features. And I do believe that because I have seen in my personal practice hundreds and hundreds and hundreds of patients. And I would say 90% of them are positive, happy people. There's 10% that, okay, dealing with helping them with their depression, anger, anxiety, whatever, right? But yeah, having a case like this, one in a century, yeah, I would agree with that as far as ratios of seeing patients. If you're in medical care, you know what I mean, no matter where you work, there's always that one case that you remember from your entire life that was different from any others. And I'm not saying it's demonic attack, but you always remember that one patient that was the wildest experience you had, right? This would be his. So, he ruled out psychosis. He noted her non-psychotic background. So he did say that this one's possessed. This is not mental illness. I mean, I get goosebumps thinking about this. Like, oh my goodness. You wonder when he went to psychiatry, I don't think he probably thought he was going to be dealing with demonic possession, right? Because again, we did have some classes in like mind, body, wellness. And, we touched on, because I have an acupuncture accreditation as well, and it's part of my license. And so we would have things on like meditation and all that. I guarantee you we did not talk about demonic possession and spirit attack. No, we didn't. That was not part of the curriculum. So in other cases, he had a middle-aged man we'll call Stan. And this was out of the Pacific Northwest. And this patient was reported being scratched and choked by unseen assailants, which Dr. Gallagher attributed to demonic possession. But he said in this case, it was a less severe possession. Well, okay. So that's in his book. He also evaluated a woman with spontaneous bruises just popping up on her body. And he evaluated this case early in his career, and he showed there was no medical or psychiatric cause. So if I have someone in my office that shows up with unexplained bruising, I'll talk to them about anemia. Do you know if you have a family history of any genetic blood diseases that, like the porphyria cluster of diseases, or, do hemophiliacs run in your family? Are you getting your nutrition, your vitamin C, vitamin K? Like, I'll do a blood draw. We'll do a complete blood count, maybe a peripheral blood smear. Like, we'll look into the cause of where are these bruising. Are you taking too much aspirin? Like, right, that's a good one. Or are you drinking alcohol? I'm sure he went through all those things. He couldn't find anything wrong. She was just popping up, wake up, and having all these bruises on her. So he said there was no psychiatric cause. And on this woman, he said it was demonic attack. Makes you think twice about the bruises you're waking up with. I'm just kidding. I'm not trying to scare you. I'm sure you're fine. Okay. So there was actually criteria for possession. So Dr. Gallagher would look for classic signs. Get this. One of the signs was superhuman strength, trance states with demonic voices, fluency in unknown languages, hidden knowledge, remote viewing, hostility to sacred objects like a crucifix. So maybe those vampire movies weren't wrong after all, right? And then, of course, levitation. Very rare phenomenon. I have never seen it. I talk about levitation in one of my videos, but I never witnessed anything like that. 10 years of hospice. Yes, I've seen some things. Never saw levitation. Not saying it doesn't exist just because I've never seen it. And I think it's interesting that he did use specific trained psychiatric assessment to rule out any mental illness on these patients. He would also rule out epilepsy. And then he would collaborate with the priests and the clergy on the Catholic exorcism protocols, because these protocols require psychiatric clearance. Yeah. I don't know if you see that so much in the movies. I don't know. So if you're interested more in this story, yeah, it's from his book, The Demonic Foes. Well, should we talk about skeptics? Yeah, we should. We've got to keep this video balanced. It's important. So, and it helps keep me open-minded. I have to remember to be open-minded on both sides. So critics argue that Dr. Gallagher, that his conclusions lack empirical evidence and that they relied a lot on hearsay or witnesses. And that possibly his leap to demonic possession was a category error, suggesting maybe telepathy or even cold reading maybe were alternatives to demonic possession. That's what some skeptics said. Others claim that Dr. Gallagher's beliefs are delusional. And in the APA's definition of delusions, it's just false beliefs. I don't know. I think that's so, what's the word? It's that besides mean, it's condescending. It's just hurtful. It's so insulting. I feel like, I'm sorry, I'm trying to read the skeptic's point of view, but that's just really insulting to someone, just calling them delusional. And is that not the brush off of the century? Like, oh, he's just delusional. Well, okay. Okay. And why I get kind of upset about that is because sometimes I'll see patients that come to me that, whether they're undergoing pain, chronic diseases that are just being brushed off by their provider, and then they end up coming to me. And sometimes they just want someone that's going to sit there and listen. That's all I'll say about that. I think, on a side note, plenty of doctors out there are doing the work of heroes, selfless, full of the good spirit, and doing everything they can. I know the medical field has lost a lot of trust. I know that. And I do want to do some videos to address that. I don't want to do it on this one because I want to focus on Dr. Gallagher, but I just had to say that. Other psychiatrists criticize his work as unscientific, comparing it to discredited Freudian concepts. And they were fearing it was legitimizing harmful exorcism practices. For example, Anneliese Michel's death. Again, I don't agree with that analysis. I'm just going over what the skeptics are saying. So let's see. What is Goodreads? Let's go over the Goodreads reviews, right? They say there's a pro-Catholic slant in Demonic Foes, the book, with speculation about modern spirituality's risks, lacking rigorous study. Well, okay, so there's the skeptic's take on Dr. Gallagher's work. I look at it, though, Dr. Gallagher, after going to Princeton and Yale and doing these pro bono medical assessments, right? He's putting his license, his practice, his reputation out there. For what? Monetary gain? No. That's kind of how I look at it. Like, so that's my position. Anyway. Some of you will think I am not correct, or some of you may agree with me. I'm curious what you think. I really am. So critical examination. Okay, fine. Let's look at this. His credentials, going to Yale, Princeton, New York Medical College, lend credibility. Agreed. His I cannot say that word today. Methodical approach. There we go. I haven't had enough coffee yet. Ruling out psychiatric causes aligns with medical ethics. Totally agree. Cases like Julia with multiple witnesses are compelling, though it's not conclusive. Yeah, okay, there's a lot of things, you guys, in medicine, when we treat medicine, and we're going on what the patient is telling us, and we will create testing, diagnostics, and a treatment plan based on what family is saying, witnesses, the patient saying. A lot of things in medicine are what the patient comes to us and tell us, and we're listening and believing it. Why this is any different, I don't know. Again, we don't know a lot about consciousness. Now, yeah, I admit my opinion is a little skewed because I do happen to believe in God and the other side, and I do think there's good. And if there's good, there has to be the opposite evil. I believe in all that. And when I see a doctor like this putting himself out there just to help patients, yeah, I kind of think it's amazing. I really do. Anyway, be curious what you think about that. And thanks for being here. Oh, put a like if you like this kind of content. Thanks.